So I want to go through this long-awaited community spread risk dashboard for school districts. So each week, Wayne County Health Department publishes a COVID-19 community spread risk dashboard to assist school districts in determining the appropriate method of instruction based on the level of spread risk in each community. This risk determination level will be provided by the county to each individual school district. It is based on examining the data 15 days prior to the report date. And I just want to mention something here. 14 days, 15 days, 2 weeks, that always seems to be for the public health officials and epidemiologists. They like that 2-week window back. They like to watch the trends like that. The county's going to use 3 indicators to come up with this weighted factor: average number of cases per day in Dearborn, a 4-week plus minus trend in Dearborn, and Wayne County's overall positivity rate. So they're using 1 indication from the county and 2 from Dearborn specifically. And this weighted measure factor is based on the 15 days. And they get their data from the Michigan Disease Surveillance System. Of course, they're on that system, the database 24/7. It's not clear to me, and I don't think it's clear to Dr. Maleko yet, if the dashboard's going to be updated weekly or biweekly. Currently, as you can see, we are ranked in E, but hopefully when the trends in our community improve, then the determination level will decrease to a D. And once our level is a D, then that appears to be like the first window of re-entry into the school buildings for instruction. The mitigation plan approved by Wayne County Health Department and what will be discussed tonight would line up with that level D, because it says consider reduced density with strict mitigation measures. So both of our plan, the mitigation plan, is going to go over reduced density as hybrid, and then strict mitigation measures will be discussed as well, and they're approved, and this has been approved from Wayne County. When we see a downward trend in the community data, then the mitigation plan is ready to be implemented in order to provide a safe school environment. Do you guys have any questions about that? You want to go over that graph?
Do we have this on the dashboard yet, or no?
Yeah, we have a link, I believe, or it's gonna be up there. We just received this at the end of last week.
Yeah, that's what
I don't know, Jill, if you can go to the matrix, because I didn't get a chance to see the matrix on the other slide.
Yeah, and
But
this is public. This is public.
So that matrix came from the Michigan Department, going backwards. No, the matrix going forward, 2 up.
Slide 6.
One more slide.
This comes from,
That
this
one.
matrix is from the Michigan Department of Health and Human Services. Again, it's part of that legislation that, so it's a way to guide with the 3,
Yeah.
So what we're saying, and again, appreciate all the nurses that were mentioned, we're looking at a multiple measures data approach. I mean, but this one actually gives you a number by looking at multiple measures. And again, we don't have to follow it, it's a recommendation, but the county, the county health department must provide it, and I've been in multiple meetings regarding this with the county health officials and the superintendents from Wayne County.
Well, I just want to make a recommendation that tonight, at the very minimum, we choose something that we can point the parents to and say, this is what we want you to look at to know where we're headed for the next 2 weeks or something. I don't want to say, okay, we got this set of numbers over here that we're kind of using, or we got this set over here that's a recommendation. I think we need to come up with something that we can absolutely say, hey, look, when you see we're in the E zone, assume you're not going to be going to school for the next 2 weeks. If you see us move into the D zone, the conversation will change. Or if we're not going to use this, if it's a recommendation, then what are we going to use? People want to have some way to evaluate where we're at moving forward. And we can't, I feel their frustration and the fact that I don't even, I'm not certain what we're using at this point.
Well, I think this matrix does bring in 3. So it
Right,
gives you
so
a
the-
final number, but you would also want to look at the county positivity rate as well.
Well, then we have to pull it all together into one,
Well, and like I said, I mean, we have already listed, in CDC, Carrie, you can comment, CDC guidelines where, you know, if you're above 5%, then you're not looking at, in-person instruction. So if you go below 5%, and then you see this other data, because here's the thing, Mary, and I get that you want just one thing, but when I'm with the county health officials, they take into consideration the trend data as well. So it's not so easy as like, sure, you could just say positivity data, here's one number, it makes it easy. It's kind of like with our, I'm using the analogy of our student assessment, and I get that people want it, but that's why we do multiple assessments to make sure that we feel the data is reliable. So if we only use positivity rate and we weren't looking at infection rates in the community or the school, but I would say we can look at this chart, they have us
Plus-
at E, plus the
yeah.
positivity
And
level.
that's all I'm saying. I'm not saying we need to use just one, but then let's post it on our COVID dashboard and say, okay, this plus this equals and what direction we're gonna be. So that people can look at it and quickly gauge what the trend is at that moment. I don't care if it's 3 different, charts that we're using or whatever, and we go with, but I would like it all to be front and center, information-wise, for the community to be able to go to, rather than clicking on this link for Wayne County stuff and this link for the Michigan Department of Health, and I want, once we pull it all together, to be able to have it on the site as as the first stop of where we're at.
So are you saying, I'll get to you in a second, are you saying, like, let's say the positivity rate drops to below 5%,
Plus,
and at the
we get a
same time, we're in a
D-rating.
D-rating,
Yeah,
then you just,
then you say, okay, we are ready to look at, that's
we're
what I'm
not ready
saying,
to start
yeah.
talking about it.
Yes, we're ready to start looking at.
Yeah.
Moving to phase whatever.
We're not gonna say,
It's a
when this
given, no.
happens, we're gonna go into
No,
phase.
no. But so that.
Sure.
Just so we're clear, just so-
we're
yeah,
clear,
yeah.
so that they know what their expectations are moving forward, that we have, you know, the direction.
So a month ago, when we were dancing around a little over 5%, we talked about it in here and said when it gets below 5%, there's some people out there thinking that as soon as.
As
got
soon
to
as it hit
3.6,
4.9,
You're just gonna hit a
yeah.
light switch on and
Right.
just bring everybody.
Right.
How do you
No.
do that with a district
Yeah.
this size?
Right.
Trustee Thorpe?
Yeah.
I would go along with what's being said. One thing, though, that I would point out is that we're talking about the county positivity rate. We do get that one weekly, but we don't know how frequently we're gonna be getting these
Yeah,
other
we don't
measures.
yet.
So
Right.
we might be sitting there waiting around for numbers for we don't know how long. The second thing is, once we see the numbers are right, and if we choose to start moving, how long will it take us to get there? And what happens if the numbers move against us in that time? And then how quickly can we shut it off?
Well, that's the next part of our
See, so-
conversation.
So I would just say that here's my recommendation, and based on this example I was using from a week ago. And President Barry makes a good point. So, you know, if you're looking at the positivity rate, you can get the positivity rate daily. So that's why we held to, at the time, we were looking at, we said in the agreement with Learning Labs, up to 2 weeks. So you do want to look at consistency within the data. So, I mean, we can't just turn a switch on Thursday, turn it off Friday, and then back on Monday because every day. So we definitely reject the daily rates because it's, you know, there could be some kind of situation that occurred that day. So we need to look at, I think, 2 weeks of data, of stable data. And that's where I believe, this is supposed to be coming out weekly, but they may change it to bi-weekly because they're looking at the consistency factor. So we will be getting this chart data at least every other week. Initially, they were gonna do it weekly. So this we will get from the county, it's gonna be posted on there, then we're gonna get the positivity rate. And I would say, you know, for our team to make a recommendation for in-person instruction, we would wanna see those levels steady over a course of 2 weeks, which is why I opened with the fact of, in the beginning, that we're gonna present a plan, but we're not giving a date until we see that data steady over the 2-week area.
That-
So I believe.
just want us all to be on the same
Yeah,
page.
so that's what we're recommending. Administration is recommending a 2-week stable data trend with these multiple approaches. And I'll be honest, the legislation, which you guys are aware, and I've commented here, we were critical, superintendents were critical of the legislation. This stuff came out after schools were a month to 2 months, a month and a half into,
Close, yeah.
so we didn't have that. And we honestly, we have the nurses here, but honestly, the health professionals, none of us really went to school. We're educators, so we're relying on the health professionals to provide that informed data. Now, we're getting better at it, and of course, that's been all my meetings, and I'm in sessions and things. But I'm still, my PhD is in educational leadership and policy studies. It's not in epidemiology. So I have to rely on that data set. So I'm saying, based on what we're getting in all the meetings I'm in, I'm getting very good at it. I'm getting better at it. I'm still not an expert, but we need that data to be 2 weeks. And what I will tell you is they're very concerned with two factors: trending data. Trending data is very important to them. And then secondly, which I'm not going to mention the district, but you and I talked about, there's other districts that have been in, and they're going to look at a specific school or a district with cases. We are putting on the dashboard the number of incidents we have to report, but, we can't necessarily report every single situation that we may just have quarantine and other things, and we're not doing that, but those go into a factor. We have other
Yeah.
districts with multiple. And so unfortunately, the public won't always see that. The board
Right.
is seeing that, but
We
we
see
also
it,
have
yeah.
confidentiality and HIPAA and other things that we can't provide certain health information. So it's a complicated situation. That is another data factor. But I will say, we put that out sooner than at most districts and prior to, because of our transparency. And I said we wanted this matrix out front, so we're being very transparent. So one of the reasons, unfortunately, why we are putting multiple, and I think Jane has been part of the conversation, is because we want people to know that we're providing with all the data that's out there. Because unfortunately, the federal government and the state have not provided us with a one factor. So we're creating what we think. And so I'm recommending the matrix in combination with the positivity rate. And then the other factor is looking at, like I said, individual situations. And
What's
Trustee
going on
Thorpe,
in
you
our-
said this to me. I mean, there might be a situation at a school, but it doesn't mean the whole district. So we have to take into account individual school situations. So that may not be a one-size-fits-all. So that is what
We
we're
all
recommending.
need to be in agreement about
And
what
if
we're
the
going
board
to
agrees
use.
to it, we're gonna pursue this data, and that would give us the opportunity, by the next board meeting to come in and say, okay, look we've had 2 weeks of steady data, now we are recommending this as a start date.
Right.
Or we may come in and say, look, no, we haven't, it keeps growing, the positivity rate has gotten worse or it has not improved, along with our recommendation from the epidemiologists with the matrix, we cannot recommend the in-person. Maybe we have to continue with the learning lab. So
I'm good with
that's
it.
where I would like to go with it. Again, it's to the pleasure of the board, because we make the recommendations, but ultimately the state has put, the board has to,
requirements, yeah.
you have the
Yeah.
final say as to the decision. And I know it's tough decisions for all of you, and it weighs heavy, so hopefully that would help, but that's administration's recommendation.
President
Moser?
Barry, I totally agree, and I believe if we adopt those measures, that they need to be clearly presented on
Yeah.
our website in one simple dashboard on the main page as what indicators that we're looking at to reopen the schools.
We can do that once, if we
Yeah,
get
once we
direction that you agree
yeah.
with it, we will do that.
That's what I want to see.
Okay, let's let our nurses finish up their report. Did we have
Okay,
anything else
I'm
to
gonna
add?
think
turn
Amy-
it.
oh,
I'm
sorry.
Yep.
I think Amy has something she wants to present, and this gets into the school reports. Trustee Lane had asked for this, and I think others are interested, so I'll let Amy go ahead.
Please.
And we knew this was gonna
Okay,
be an
can you
important,
guys hear
long
me?
part of the presentation, so. Thank you, Amy.
You can hear me okay?
Yes.
Yes.
I was having some glitches with my computer this afternoon, so I'm glad it's working now. Just to introduce myself for everyone out there, my name is Amy Candace, and I am one of the 5 nurses that make up the Dearborn Schools district team. Carrie has given a shout out to our other teammates, and I just want to say I feel very lucky to work in a district where we've been asked to come to the table to assist with this reopening, and I'm very happy to be working alongside such knowledgeable and very hardworking nurses. So my responsibility tonight is to present the Dearborn specific school numbers on isolations and quarantines. So Carrie has given you the rundown of what our county numbers look like. And I'm going to let you guys in on what we've been seeing happening in our schools with our staff and in the learning labs. The first thing is on our school website under the under the COVID information. If you click on that, you will see that we've linked into the Dearborn Public Schools dashboard. And this is where we report our weekly, I'm sorry, of course my dog's been quiet until it's time for me to present. This is where we're reporting our weekly probable, the presumed positive and confirmed COVID-19. They are determined to be the cases of individuals who've been on the school campuses during their infectious period. I want it to be noted that often this is because they've developed their COVID symptoms. And when we do our contact tracing, we're looking back 48 hours from when their symptoms started or when they have their positive test. So our tracing has shown a lot of the times that our staff and students, when they are on campus and these numbers are counted as being a case in the schools, it's not because they knowingly went to school with symptoms. It's typically they may have developed them later or after school hours, and then we go back 2 days to kind of contact trace and see who they've been in contact with. Our mitigation, that's one of the reasons why our mitigation plan is so important as we move forward to trying to get the students back in for face-to-face learning. Reporting of our numbers is weekly, and it's mandated by an order from the Michigan Department of Health and Human Services. And as of October 12th, the schools are also mandated to report a positive case on school grounds to staff and families within 24 hours of the schools receiving that information. So staff and family members are seeing these notifications show up in their emails and also posted on the individual school's website. Let me pop back over here. Did you guys see the dashboard? Do you know where that is and what that looks like, or do I need Jill to kind of show that to you?
No, I know.
Or I don't know if it's being shown, and my screen kind of glitched and I'm just seeing everybody's
And Jill, if you
live
click on that,
pictures and
you
the
get
screen.
the individual, all the,
Further down?
no, click on the actual square.
Oh, there it is.
Yeah.
Okay, now I'm seeing the screen. So on the first part of that page is what our weekly average or what our weekly numbers look like for the week prior. The nurses are putting together the numbers and we were reporting them to the communications department for upload here on Fridays. When you click on that dashboard, it will take you to the history. And this is what we're seeing right now is from the time that we started to do our contact tracing, which I believe was probably in the late summer, August. That's when we started to keep list or keep track of our cases that we were seeing in the schools. And so I do have a breakdown a little bit further into the presentation here on what our specific numbers are. The school nurses have been assisting the district with contact tracing, and notifications to our schools. What we have found is that both staff and students have been quickly notifying the schools of any exposures or quarantines and or their positive results that they may have received. They're notifying us even before the county health department has received the results in their databases. So to date, the health department has not had to contact Dearborn schools about any positive cases. In fact, our school families and staff are quickly notifying us, and we in turn are then the first to notify the health department of a positive case. This has allowed us to intervene quickly, to offer guidance, and to limit the spread in our schools and ultimately in the community. We have a close working relationship with the local health department, and we're able to reach them within minutes to review or verify that the appropriate guidance was given. So Jill, on that presentation sheet there, it should have the October numbers at the very bottom. Can you link onto that and I'll show you what we're looking at currently?
This sheet or the other one?
It's the previous slide, show the one that Carrie had. Remember you have a link in there on COVID incidents?
Yeah, I'm sorry. I can't see the screen, so I can't direct you.
What,
Dave put it in, let me see if I can find where he put it. I think it was right after, it's right towards the bottom of that screen that had the data trends on it. Oh, there it is. Yep. Okay, so I counted the cases that we had for the month of October. And I just did October because this is when we started learning labs back on the 5th, I believe. So towards the top there, you could see, let me see where my numbers are here. So the October numbers there for the first part of the week from 10-3 to 10-9, we had staff members, two were on campus, isolated, meaning that those 2 are counted in our numbers as being on school grounds during the infectious period, and 1 student, and that we were notified of 2 staff quarantines that were needed at that time. It's important to note that that the cases that we're seeing in school are because of community spread. So the cases are being acquired outside of school, but they are an employee or a student or of the district. And so that's where these numbers are coming from. We've not seen the spread of it inside the schools. And that's because our staff and students are really doing a good job following the mitigation measures. So as we walk through this, the numbers that we're seeing here are mostly because they've been exposed by a family member or somebody outside of the school has gotten COVID or was in contact with somebody, and that's why we're seeing them here in the school system. So the second week, you can see that the numbers, isolations were 1 and 1, and then 2 and 8. Again, the off-campus ones are students and staff that we were notified, but that were not on grounds during the time of infectivity. And then for the week of the 17th through the 23rd, this is the week that we paused the learning labs. And in the very beginning of this week, we were starting to see a significant increase in the community rate of positivity. And there were a few events that were in Dearborn that seemed to have increased the numbers that we were seeing in school. So these were, again, events outside of the school system in the community that we were seeing them touch into our buildings because we had family members that had been exposed, and then kids in quarantine because of exposures. And then we were seeing an increase in positive tests. So it was that Friday before this, so the 16th, I think 15th or 16th, the nurses started to do quite a bit of contact tracing, and we were really starting to see an increase in the number of positive COVID cases that were being acquired, and also an increase in our quarantines. So I think by that Tuesday morning, we had been in communication with the health department. The health department had said that they were seeing some concerning increases as well in the community. So I just wanted to show you that in blue there, that's that week there that we ended up pausing the learning labs. And you can see that our numbers of isolated cases and quarantine cases were significantly larger in that week. So it is something that the nurses that we're monitoring along with the health department, how our numbers are trending. And then we were in communication with the administration to kind of notify them that something's looking a little off here. We're starting to see an increase that's becoming a bit concerning. And so along with the epidemiologist and Wayne County Health Department, we were communicating with that, with them with that as well. So this is where we started to see the community rate of positivity increasing. And because we were seeing an increase in numbers in our communities, it also transferred into the schools. And then we haven't finished out the week, but this is the green area is just our current cases that we're working on this week. So the staff and students have been following the mitigation measures our district has in place, and that's been evidenced by the limit of the additional exposures on school grounds. The cases that we are seeing are acquired by community spread, and from there has been brought into the school. This has not been spread inside our schools. Because our strict mitigation measures and our school community's adherence to the plan, we've been able to limit these community exposures from spreading inside the schools. With these measures in place, I'm confident that we are doing all we can to make sure our staff and students are safe upon the return to school. At this time, only one Dearborn school has been listed as a possible outbreak site. Outbreaks on community grounds are reported as 2 or more positive cases that appear to be linked by a probable school exposure. Currently, to date, only Salina Intermediate was listed as a likely outbreak, and that was back around September 18th. So even with the county's increase in COVID cases, no additional outbreaks have been noted inside Dearborn schools. So I really have to say that our staff and students have been doing as much as they can to try to mitigate this by keeping their social distancing and watching their time spent in closer distance. And they really need to be commended for that. They're making the school nursing job easier when it comes down to contact tracing. And when we go back and ask them, you know, who they had exposure to in the days prior to them receiving their results, you know, a lot of times we can put down there's been no close contacts because, you know, they may or may have been in and out of offices or had, you know, very brief contact with coworkers or students. But because they're following that mitigation plan, we're not having to do a lot of contact tracing outside that isolated case. So just to report, because Mason has been giving you the numbers of our totals. And so the last thing that I have for you is what we currently have, or how many we currently have in isolation and quarantine. So looking at complete totals prior to tonight, we had 43 total staff members that were isolated. And in the 2 weeks from your last meeting, we've added 9. So we had 43 previously plus 9 since your last meeting. And then for staff that are quarantined, we've had a total of 34. And in the last 2 weeks, we've increased by 25. For students, isolated previously were 25 and newly added from your last meeting was 15. And quarantine students, we had 25 previously and added 17 additional quarantine, and that's outside of our athletic numbers. Hard when we end up having a close contact for an athletic team, then we start seeing a larger number of kids that we want to quarantine due to a possible exposure. So I believe we would add an additional 34, 35 based on athletic team that we put into quarantine based on an exposure. So that's what I have for you tonight. Are there any questions for my presentation?
Nurse Amy, thank you. You kept it professional. You just mentioned 2 events in the community. I know when we started talking about this before we opened up schools, there was a lot of inside weddings, major weddings, a lot of picnics, and that's what slowed us down. And yes, you're right. This past week, there was a couple of events. I'm starting to hear about parties now, Halloween parties. We're not here just tooting our own horns. In the school system, the plan is working. The students, the parents, they are reporting. The staff members, what happens is if a staff member is not feeling good, he or she will make a phone call to the administrator. One of the nurses will get contacted. Wayne County's the next phone call. Then they give us directions on what to do from there. And those reports come to us on a daily basis. We're probably getting sometimes 2 to 5, sometimes 6 reports every day. So those numbers are real. So yeah, we are doing a good job in our buildings. Our staff, our students are following orders. You stay home for 14 days. You come back after you test negative and you're not showing any symptoms for 10 days, come back to school. We just, again, I can't stress it enough. We need the community at large to change the behavior in order for us to get our students back into school. Trustee Thorpe.
Yeah, a couple of quick questions and clarifications. Nurse Candace, I think you said that, and I'll paraphrase slightly, school spread has not been occurring that we can see, right?
Not significantly, correct.
Okay.
There's very few isolated cases where we've had to, maybe we have a positive individual that's had close contact inside the schools.
Okay.
And then currently, when the state and the county are looking at outbreaks, what they're looking at is, are there 2 or more cases inside a school that appear to have shared the virus on school grounds? And Dearborn has only had one of those schools, and that was back in September with Salina Intermediate, that there may have been a likely spread of COVID on school grounds in that instance. But otherwise, the instances that we're seeing of positive cases are isolated cases. Maybe we have a family event that's outside of school where we have multiple family members that are positive and they work for the district. That's what we're seeing. So we're not seeing the spread of positivity in the schools. It's mostly coming from outside sources. I'm so sorry.
The dog wants
He
in.
was so
Dog needs to be
quiet.
fed.
My cat is usually up my feet.
I'll try to make the next questions quick so you can feed it. Explain, help me understand quarantine, 2 parts of it. What have we learned about how long does it usually take for a person to show any types of symptoms or test positive from the time of an exposure? And the second is, while we say 14 days, if a person says, I've been doing this for 5 or 6 days, I'm going and getting a test, the test comes back negative, we're saying you still have to remain in quarantine even though you've tested negative, correct?
Okay, let me clarify a little bit. So, I'm so sorry. Can you remind me the first part? I just lost my
First
train of
part
thought.
is how long
Um,
after exposure does it usually take before a person would either have symptoms or
Okay.
test positive?
So generally, the health department is saying that the quarantine is 14 days. And the reason why we quarantine for 14 days after an exposure is because generally you can see the symptoms developing between 2 and 14 days after that exposure. So in around the end of July, the CDC changed their guidance on negative testing. So it had been that you could provide 2 negative tests 24 hours apart would end your quarantine. But in July, they changed that. And so now if you are told that you are a close contact, you will quarantine for 14 days, regardless of negative testing. What I can say, kind of like off the record, what I've been noticing personally through my own contact tracing is generally we're seeing a conversion from an exposure within about 2 to 5 days is about what we've been noticing when we're doing our contact tracing. That's not to say that we don't have a case that shows up, at the 10th day or 11th day that begins with symptoms. But just from what we've been seeing from doing the work, we're generally seeing that conversion within about 2 to 5 days of their exposure. The second part, I think what was that again? You asked about the quarantine.
I think you answered
you
both
got it,
parts.
yeah.
So it sounds like
answered all in
CDC
one.
hasn't really come out and said that this percent usually have shown symptoms or been diagnosed positive in so many days.
Yeah, it's officially about 2 to 14 days, and that's because that's been the range that they've been seeing. Like I said, typically just from my own contact tracing, I'm seeing if you're going to have a lot of it is likely family exposure. So you're around people more often. Those are cases that we're seeing convert from to positivity. And it's basically because you're sharing a household with somebody. Again, that's just from my experience, from what we've been contact tracing in the district. And after the interviews I've conducted, those are the things that I'm noticing.
Thanks.
But yeah, so you do have to quarantine for 14 days after your exposure. And that's because that's the time frame that you need to monitor for symptoms.
Dr. Malik, you had a follow-up to that?
Yeah, I just want to clarify one thing too, that, the outbreak that's mentioned, the state publishes those, and the board has seen, but again, we're talking about 2. It's not like there was this massive, so just to clarify, so people aren't, this was just 2, and we don't control that. The state publishes that on their website. So we've only had one time where that, I believe, has occurred, and it was 2.
What I'm hearing you say, even before it was mentioned, this was public information. already,
Yes,
so thank
yeah.
you. Trustee Petrikov?
Okay, just to clarify something else, on the dashboard that we make public with the cases, doesn't show the same thing, information that we get about the amount of students who, or staff who are quarantined. You did give
Right.
the general
I
numbers.
did
We
want to
see,
mention that,
we
so
see
thank
the
you
whole
for reminding
breakdown.
me.
We do have access to the whole breakdown. Now,
Right,
that
you
being-
are, so what you're seeing, what you're seeing on the dashboard are positive or presumed positive cases that have been on school grounds during their time of infectivity. So the nurses, we're contact tracing more than that. But you know, a lot of that is, you know, a staff member or a parent calling in and saying, you know, my son or daughter was with their uncle, and the uncle we found to be positive, and so my student can't come to school because they're considered a close contact. So while we're keeping track of those, or we have, you know, a staff member that calls in and says, I've been working remotely from home, I haven't been in any school, but I found out that I'm positive. So we are keeping track of those cases, but in terms of what's being reported for the communities, for the school community's knowledge, are cases that have been on school grounds during their time of infectivity. So we do have, there is a difference in numbers,
Right.
but the ones that you're seeing are the cases that have been on the premises during that time of infectivity, when we see symptoms and then go back and trace for 48 hours.
So the next question
And then,
then
and
is,
one is back on that week of 10/17 through 10/23, we reported a total of 7 positive cases that are listed on the dashboard, but I actually have 8 positive cases between staff and students. And the reason why there's a difference in that number is because one of our quarantine cases converted to positive after we reported that number.
that was my next
we would
question.
go back and list that quarantine as
Yeah.
now transferred over as to a positive. So that's why we have 8 that day, but we're only, or 8 that week, we only saw 7, was because we got the notification that they turned positive after our report.
Okay, so that was my next question, that anybody who's been quarantined, who converts to a positive, we will fold into those numbers then?
Yep,
Yeah, okay.
if they've been on school
If
grounds.
they've been on
during the
school
time that
grounds when they were
that
quarantined because of exposure to
Yeah.
the positive case that was already in this
Yep.
number. Yeah, okay, I just wanted to make sure I understood it.
Yes, and typically when we're notified, oh my goodness, that dog, I swear, I'm so sorry. Typically I'm by myself in the house, so I can't even send the kids to go get them. The quarantine, when we get cases and we're notified of quarantine, we are kind of doing that initial contact tracing right off the bat, so that in case something happens where they do end up turning positive, we already have that information ready to kind of look back and get on top of what we need to do to kind of isolate that.
Hey, Trustee McDonald had her hand.
Trustee McDonald?
Yes, just tagging off of Trustee Thorpe's question. When you were talking about, Nurse Amy, when you were talking about generally from your experience into tracing, 2 to 5 days from exposure, and that's when symptoms occur. But I'm under the impression that infection precedes that. Is that correct? And about what is the time frame for being contagious?
Yes, so when we're talking about what is the time frame for being contagious, it's what we start with is either the onset of symptoms or the positive test. So for our families or kids that are asymptomatic but end up getting tested and they're positive, they didn't develop symptoms, we would start our guidance from the date of that positive test. But most of the time what we're seeing is that somebody's developed symptoms, and those symptoms haven't gone away. They've gone to get their COVID test, and then it ends up coming up positive a couple of days later. But we are looking back to say, when did your symptoms develop? And that's the first date that we go by. So if they say October 1st was the date of my symptom onset, then we're looking back 48 hours before that date to find out who they saw and who they were in contact with on school grounds, and if we need to do contact tracing.
Okay, thank you.
Trustee Moser?
I just want to say that contact tracing has been the most effective way of winding down infections. So This is very, very important work, and I urge everyone to be cooperative with the nurses and the health professionals, because if we were to be in person, or even right now when we have cases, the information that's being shared is so crucial and so important. So to keep people safe. So the more information that you share with our nurses, all of the people that you've interacted with, the more helpful it is, and to avert any future shutdowns, because it's crucial that you give honest information so the right people will be identified to be tested.
Anybody else?
Just to reiterate too, that we're often finding out about our positive cases from staff and students minutes after they get their results. And they've been contacting us by email and, notifying their supervisors. Sometimes they'll get the email that says, it's 5 o'clock in the morning, and you're seeing like an email at at 6:15 that says, I got my results, what do I do? So it's been extremely helpful, and it's been a positive for our school community, because we're finding out oftentimes before the health department does, which really just allows the nurses to kind of step in and give that early guidance, so that we're kind of limiting that the additional exposures that might happen while they were waiting for that data to come from health department.
Trustee Lane?
Do we know anything else demographically about the spread? We know it's community spread. I know of the people that I've recently heard of, they're mostly younger people that I've heard of. So I would just throw out a caution to the board in the future for making decisions. Right now, I mean, we look at percentage of total for testing. More tests doesn't drive up the positivity rate. It just tells us whether people are positive or not. Doesn't matter the whole number. What matters is the positivity. But I've heard more of younger people, so that does affect the fatality rate, which was, I think, higher earlier on in the year. Do we know anything else that can be pulled out of the demographic data?
Dr. Maleko, we're getting those reports on for the Wayne County meetings that have the specific demographics. I don't recall where they were. I do know that we had conversation that had said they are following that data in terms of the age of who's being infected and who's positive. And originally it had started out where he hears me talking and then he starts. I put him back there too so he'd be quiet. Oh my goodness. So I'm sorry you have to listen to me through him and his whining. But so it started out where we were seeing the middle-aged population were the people that were getting infected a few weeks ago. Then it seemed to drop back down to when the schools started to open up, they were starting to see it more in the teenagers and the young adults. And at my last update, I think that we're starting to see it come back into the 40s as their mid-range. So it is kind of moving in and out of these age ranges. But they did initially think that we were seeing more of the younger population. We're having more sports events. The kids are starting to come back into school. The data also supports that the students, the younger students have not had as hard a time, obviously, as the older. That's not really changed. And that still stands true, that the students, the younger kids are managing this virus a lot easier than the elderly are. And that hasn't changed throughout. So that still remains the data that I see, that the younger kids are managing without much issue. And symptoms are fairly mild in that age group. And then, again, still being cautious with our high-risk community area.
Great, thank you. Thank you. Dr. Maleko?
Thank you again for the presentation. We knew this would be long because it's very important, and we had predicted. I just want to mention too, so that everyone knows, and I know the board is aware of this, when we report it out, we will, the nurses are in charge of determining who was the close contact and tracing. And when we notify staff in the community, we cannot give out names by law, and we protect the individuals. I know the board gets staff A or staff B even, but
Yeah, it says he, she, we don't even know.
yeah, you don't even
gender.
know. So we have to, that's the law. And so I want everyone to know is that that is something that we must follow. We've talked to our attorneys and it's the right thing to do. Having said that, we put trust into the nurses. So only the top executives, HR, if it's staff, and students, obviously student service head would know because they have to implement. But just so everyone knows, we cannot report names, nor would we ever, because it wouldn't be the right or ethical thing to do. Having said that, the nurses know whom it is, and again, I credit our staff and our students for self-reporting, and they will let you know if there's been a close contact. So you have to have trust in the process, because if someone got sick, they wouldn't want people invading their privacy, so we're gonna adhere to that. So I thought that was just important to get that on record as well.
Thank you. Trustee Thorpe?
Following up with what Dr. Malenko just said, if somebody chooses on their own to let other people know
Sure.
that they tested positive, that's on the individual, but it didn't originate at the schools in terms of where the information came from.
Okay, great.
Good
Thank you.
point, thank you.
Anything else? Well, Nurse Candace and Nurse Khan, thank you very much. We appreciate all your
We're
work.
very
So
grateful
give
to
them
our
a round of
nurses.
applause.
Another duty
May I
well
say one
done.
thing about Trustee Thorpe's comment?
Please.
Legally, I think that he should qualify his comment by saying legally. I personally feel that people have a moral obligation to let other people know if they're positive. And I would just note for people, of the people that I know, many of whom aren't here in Michigan, but we're on like a listserv together. Most of the people who texted each other and said, I'm positive, they were very embarrassed about it. So they really hated telling us, their friends or family, I'm COVID positive. I'm glad they did that because then, we can take over a meal or whatever, we can support them. But there's one thing about something being a legal obligation, there's something entirely different in our social obligations to each other. And it takes courage to tell people I was positive, and they need to do that so that we can all try to protect our vulnerable people.
Thank you, Trustee Lane. To our audience, I just want to let you know that our citizen participation part is still open, and will be until we get to that part of the agenda. And to the audience that just tuned in, and yes, they just want to hear, are you going to open up schools or not? That's all we want. This is very valuable information. And like Trustee Petrikov clarified earlier, we don't get to sit around and get all this information. So tonight, all this study session and all this information we're getting is very, very valuable to help us moving forward. Dr. Choko?
Our next presentation?